Good morning and welcome. My name is Erin Sorrell, and I am an assistant professor at Georgetown in the Department of Microbiology and a member of the Center of Global Health Science and Security. I have the extreme honor to be the director of the Elizabeth R. Griffin Program at Georgetown. October is Biosafety and Biosecurity Month, and the Elizabeth R. Griffin Program has the honor to host this month's seminar. The Griffin Program was established to honor Beth Griffin, a young research assistant who experienced an occupational exposure of B virus while working with rhesus macaques. This exposure could have been prevented based on strong institutional practices and procedures, but delays in diagnosis and treatment led to the unfortunate death of Beth in 1997. Her family established the Elizabeth R. Griffin Research Foundation, now the Elizabeth R. Griffin Program, to build awareness on biosafety, biosecurity, and the importance of safe research practices throughout outreach, advocacy, and education. The Griffin Program came to Georgetown in 2019, and since then, we've really looked at sustaining the efforts of the foundation, looking at collaborative research, training, and education, promoting evidence-based biosafety and biosecurity practices to protect health and safety of researchers, as well as workers on the front lines of disease detection around the world. We work with a range of international partners to develop and implement sustainable local applications for biosafety, biosecurity best practices. It is my absolute pleasure to introduce our two speakers for today, Dr. Lisa Indar and Ms. Sasha Wallace Senskarsing from the Caribbean Public Health Agency, or CARPHA. CARPHA is the sole integrated regional public health agency in the Caribbean, responsible for preventing disease, promoting and protecting health in the Caribbean through leadership, innovation, and partnerships. CARPHA serves 26 member countries and is currently leading the Caribbean's health response for the COVID-19 pandemic. Dr. Lisa Indar is a director of the Surveillance, Disease Prevention and Control Division at CARPHA, where she is responsible for directing, coordinating, and managing public health surveillance and response activities related to conditions of regional and international importance. Dr. Indar has 18 years of regional and international experience in managing and executing regional public health surveillance and response programs. She is currently the technical lead for CARPHA's comprehensive, multifaceted regional health response to the pandemic, working with CARICOM, heads of government, agencies, international, regional, national, and multi-sectoral stakeholders to help keep the Caribbean safe and promote a safe economic recovery. Sasha Wallace Senskarsing is the biorisk manager at CARPHA. She has over 14 years of experience working with medical and public health laboratories at national and regional levels in the Caribbean community through CARICOM. She has led multiple capacity building initiatives in over 20 countries in the Caribbean and as part of the COVID-19 response. In her current post, Sasha manages the Biosafety and Biosecurity Program in CARPHA Medical Microbiology Laboratory, Biosafety Level 2 and 3 labs, as well as coordinating the regional network of national focal points for biosafety and biosecurity. She is the current 2020-2021 chair of the Global Health Security Agenda's Action Package PREVENT, or APP3, on biosafety and biosecurity, a member of the board of directors on the International Federation of Biosafety Associations, and have been involved with various initiatives, some including collaborations here at Georgetown. Dr. Indar will be making some introductory remarks ahead of Sasha's seminar on biosafety, biosecurity, a foundational regional health security in the Caribbean. If I could please note that any questions that you have during the seminar, please submit in the Q&A, and we will monitor and take your questions at the end. This is going to be recorded and will be posted in the next few days on the event page. Thank you all for attending. We welcome you, and Dr. Indar, over to you.
Right. Good morning, pleasant good morning, Erin, and to all the attendees on behalf of our Executive Director, Dr. Joy St. John. It really is my pleasure to be part of the Elizabeth R. Griffin Program's monthly Global Health Security Seminar and to have the work of the Caribbean Public Health Agency and Ms. Sasha Wallace Senskarsing highlighted as part of the proceedings of the National Biosafety Month. I would like to take this opportunity to share some key aspects of the work of CARPHA and hopefully encourage some of you to apply for internships with us during your semester breaks. CARPHA, or the Caribbean Public Health Agency, as you said, is the sole regional public health agency, and it is the recognized institution of the Caribbean community, CARICOM, with responsibility for public health. Our vision is healthy people, healthy spaces, healthy Caribbean. And we really walk that talk in all that we do. Our mission, as we said, is to build the capacity of the 26 member states to prevent disease, promote health and wellness through leadership, partnerships, and innovations in public health. We were legally established in June 2021 through an intergovernmental agreement that was signed by the heads of government, the CARICOM. But more importantly, we are a merger of 5 regional public health institutions, which includes the Caribbean Environmental Institute, the Caribbean Regional Drug Testing Laboratory, the Caribbean Health Research Council, and 2 PAHO organizations, Caribbean Epidemiology Center and the Caribbean Food and Nutrition Institute. So we are 5 into 1, and this merger makes us one of the most unique public health agency globally, in that we are doing communicable disease, non-communicable, environmental health. We have 3 different types of labs, and we serve 26 countries. Both Sasha and I would have worked together at CARIC before, which is the base where CARPHA is headquarters in Trinidad and Tobago. And we do have our other satellite campuses in St. Lucia and Jamaica. We began operations in 2013, serving our member states from way up in the North, Bermuda, down to Haiti and Belize and the United Kingdom overseas territories, the Dutch-speaking English territories, and all the way down to Guyana and Suriname in the south. So as you can imagine, our scope of work is wide, but that's what makes us relevant, and that's why we are so happy to be part of this initiative. So regional health security is our major priority, and most of what, in fact, all what we do is geared towards health security, in one way or the other. And to do that, we focus on communicable disease, emergency response, non-communicable diseases, laboratory services and networks. We have a unique travelers health program. We have a unique environmental health and sustainable program, our field epidemiology and laboratory training program, medicines and pharmaceuticals, and health research, and repositioning CARPHA on the political agenda. So before I hand over Sasha to describe a program of work with biosafety and biosecurity, I also want to mention our regional coordinating mechanism on health security, which we call the RCMHS. This was established in 2015 when we started to deal with Ebola, and it was established as a regional mechanism for dealing, with public health emergencies. And it was endorsed by our heads of government. And on November 2014, we had to prepare a document to say stop Ebola here and now. But the RCMHS continues, and it's the way how we coordinate emergencies, public health emergencies, with all our different organizations, so PAHO and PHAC and so on, and our countries. And the primary purpose is to really oversee coordination and planning and implementation for regional response to public health threats and emergencies, with a focus on strengthening our member states, including the IHR capacity. As a chair of the Secretariat of the RCMHS, CARPHA provides technical and administrative support, which includes monitoring potential and active threats, advising member states on preparing for and confronting threats, and monitoring the implementation of the agreed commitment to improve regional vigilance and cooperation. This role includes coordinating the activity of the RCMHS members to ensure goals are made and met in the pursuit of regional health security. We have been fortunate for the opportunity to serve in the global community as well, as Sasha, as you indicated, with respect to Sasha being the recent chair of the Global Health Security Agenda's Action Plan on Biosafety and Biosecurity. and becoming a member of the GHSA community, with special acknowledgement to Sasha. I hope you enjoy Sasha's presentation, and I look forward to your questions and at the end of this presentation. Over to you, Erin. And sorry about that with my feet. Yes.
Not at all, Dr. Indar. Thank you so much for those comments. And we know you are a very busy woman and in demand. So it just goes to show how many people need your time and attention in the morning. So we appreciate you very much. I am going to hand it over to Sasha. Sasha, I will pull up the slides and we can get started. Dr. Indar, thank you so much for your opening remarks and for being here with us today.
Thank you very much, Erin, for this invitation to be part of this month's seminar, and Dr. Indar for your opening remarks there. While Erin, you pull up the slide set, I just want to say a special thank you to Dr. Claire Stanley for her introduction to you, Dr. Erin, and I'm really looking forward to seeing National Biosafety Month be something that we can also have in our own region in the coming years as we evolve and we grow in the business of health security, but for biosafety and biosecurity specifically being a foundation for health security. And as you mentioned, Erin, I do have responsibilities for the Laboratory Biosafety and Biosecurity Program at CARPHA's facilities. But I also have a responsibility of working closely with our member states and helping them to improve their national capacities. So today my talk will focus mainly on the work that we've been doing among our member states. So next slide, please. And I want to thank Dr. Indar for her opening remarks and introduction about our agency in its entirety. I hope that one day we can have the opportunity to give you a brief tour of our facilities that you can see there in the picture. As we know, travel is not what it used to be, but thanks to the virtual environment, we are able to reach a wider audience like today. So I wanted to just point out with respect to our member states there, as you can imagine, they have varying needs and capacities. And so as a whole, there's a reliance on solidarity. And really in the Caribbean, you know, we do embrace that term, no man is an island. And in terms of promoting and advocating for health security at a regional level, if we don't have the ability to leverage our resources, we would not be, we'd be in a much worse position through the pandemic. And so I'll be mentioning briefly some of the things that we've done at the regional level and together with the countries that really prepared us in a way for what happened at the end of 2019 and of course all of 2020. We're all experiencing it with the pandemic. So next slide, please. Thanks. So I can't start to speak about biosafety and biosecurity without pointing to the North Star. For public health, those of us working in public health, that is the World Health Organization's international health regulations. And as many of us know, the IHR has as its purpose and scope to prevent, protect against, control, and provide a public health response to the international spread of disease in ways that are commensurate with and restricted to public health risks, and which avoid unnecessary interference with international traffic and trade. More recently, over the last 5-6 years, we've had the introduction of the Joint External Evaluation Process in 2016, and this has been used by many agencies, including CARPHA, to guide our work towards enhancing health security. So no doubt many of us here today are aware of the findings of the 2019 Global Health Security Index, which highlighted severe gaps across the board in all countries in terms of being prepared to handle a health emergency. And of course, I think while there have been many gaps identified from the 2019 GHSI report, I think we've all sort of banded together to get through the pandemic. And so we've seen a lot of movement towards enhancing capacities, moving capacity levels up the board and across, particularly with the JEE scores for many countries. And so according to WHO, as of 2021, 113 countries have now conducted a joint external evaluation, while lagging quite a bit. Only 70 countries had developed national action plans for health security. And so this is a lot of the work that CARPHA and others, PAHO, of course, CDUS, CDC, and other partners are working with, particularly in our region, alongside countries to one, in fact, apply and go through the process of having a joint external evaluation conducted, and of course, subsequently developing and implementing those national action plans. And that's where the RCMHS and the roadmap for the Caribbean Global Health Security Agenda has its focus on. And so now I'm going to turn more specifically in the next slide to our biosafety and biosecurity program. And as we have said, in the Caribbean and through the regional coordinating mechanism on health security, biosafety, and biosecurity is listed within those terms of reference as Prevent 5.6. So it is seen as an essential pillar for regional health security. And our key priority is to provide member states with technical support to fulfill the requirements of the WHO IHR regulations, core capacity 8.2, which speaks specifically to those requirements for laboratory biosafety and biosecurity. And we've linked these to the Sustainable Development Goals, target under SDG 3, target 3D, of course, the Global Health Security Agenda Framework, the United Nations Security Council Resolution 1540, and the Biological Toxins and Weapons Convention. So quite broad, trying to ensure that we continue to appreciate the threads of multisectorality, and that it's not only medical labs or public health labs, but embracing a One Health approach towards biosafety and biosecurity. And if I were to just remind us of the WHO's biosafety and biosecurity target as written in the JEE on the Prevent 6, it is a whole of government multi-sectoral national biosafety and biosecurity system with dangerous pathogens identified, health secured, and monitored in a minimal number of facilities according to best practices. Also talks about biological risk management training and educational outreach conducted to promote shared culture of responsibility, reduce dual use risks, mitigate biological proliferation, and ensure safe transfer of biological agents and country-specific biosafety and biosecurity regulation, legislation, laboratory licensing, and pathogen control measures need to be in place as appropriate. And I think that's important in terms of looking at the local context. So even as a region, some of our strategies and our approaches working in countries, specific countries, is targeted to ensure that the local context and with the view of the sustainability is in place with our interventions and how the program, the work program is rolled out in our member states. And that's why you will see in terms of the 4 sort of broad areas working on national framework or oversight mechanisms, looking to expand the regional cadre of biorisk management experts, which we've done quite a lot of work in this area over the last several years now, from 2013 to now, and sustainable biological risk management best practices. So we're moving towards having those common educational materials be available, not only to practitioners, but also trying to work now with those tertiary institutions that offer programs that would be applicable in that way. And because of our region, I do have a slide on this. It's really important for us to ensure that we have a mechanism for the transport of infectious substances. We rely very heavily on air transportation. And so I'll touch a little bit on that. And so if I could speak a little bit about the strategies that we've been using, it's really in terms of advocacy with governmental officials for national policies to govern the operations of medical and public health laboratories. That includes the requirements for pathogen biosafety and biosecurity, including the transport sector, again, for sustainable systems for specimen transportation. And for us, it's important to talk about quality systems of laboratory operations, because we can't speak about biosafety and biosecurity if we're operating in already unregulated environments. And so for us, it's important to advocate for the regulations to be put in place at national level to ensure licensing of laboratories across the board. And so to use that as a vehicle as well to ensure that biosafety and biosecurity is included as appropriate into the national legislation for those. For many countries, a lot of this legislation is still in draft, or at more rudimentary stages as well. But as a whole, there's been a real great push through many programs, and particularly the HIV programs, to enhance laboratory quality management systems over the years. So I wanted to mention that part of it in terms of improving biosafety practices, biosafety and biosecurity practices as well. In terms of capacity building at our regional, national levels, we have again focused on increasing the numbers of laboratory professionals, tertiary level educators, public health officials with a knowledge of pathogen biosafety and biosecurity. And it goes as deep in terms of our CARPHA biosafety and biosecurity practices course, which at the end you're able to really utilize those practical skills at the lab level. So yes, in terms of awareness for officials, but anytime we host a training course at a national level, we encourage the ministries of health, who are our counterparts in country, to invite not only labs from the public sector, but also from the private sector and across the board in terms of agriculture and veterinary labs and other labs that make up part of the national laboratory network where those exist. And so we tend to see, and I've seen it, that the interest is really lies from those outside the medical labs, in fact, to learn more about biosafety and biosecurity. And so there's that thirst for knowledge. And I think with the advent of the virtual environment moving towards that, we've been able to reach a much wider audience. And so I do want to point out in terms of health security at the regional level, that our health security infrastructure was given a huge boost as well by the donation of the BSL-3 labs that mentioned earlier, that I'm responsible for the safety program there. And that was a donation by the government of Canada. My dear friends at the Weapons Threat Reduction Program, Mr. Trevor Smith and Mr. Ken Ugu, worked with us at CARPHA for almost 4 years, from conception to implementation. And lots of other experts along the way contributed in a significant way to help CARPHA increase its institutional capacity to rapidly respond to public health events. So while we've been working with countries, we've also, in terms of the regional approach, looked at what we are able to offer as well in terms of improving our own capacities and with respect to biosafety and biosecurity. And that facility has served us well since 2014, and even during the pandemic, we were able to very rapidly establish our protocols and do our initial testing in that facility before the virus became endemic. And so, Erin, if I can ask you to just move to the next slide for me. I do have just want to share a little bit more about the program of work that we've been doing with respect to capacity building and advocacy. And I want to say that none of the work that I do with countries would be possible without the network of national focal points for biosafety and biosecurity. They're the persons working in country, on the ground boots. And many of us, all of us, in fact, we're not only working with biosafety and biosecurity, but it's a passion that we all have. And I want to note that establishing this network of focal points in 2016 has been a game changer for the program at CARPHA and in the region. And in the first cohort from 2016, we had 21 national focal points. So 21 countries actually put forward the names and ensure that they had the authority to work with CARPHA on matters of biosafety and biosecurity. And now in 2021, we recently updated our network listing. We wanted to have a reaffirmation from countries about the ongoing importance of biosafety and biosecurity. And 22 national focal points were identified this year. And we've had a number of orientation sessions as well, because in addition to some countries submitting persons who have been working very actively since 2016, we've had additional persons added names of secondary focal points. So for me, that's an indication that countries, ministries, decision makers are recognizing biosafety and biosecurity beyond just having it as a token or a part of just the lab, that it's a matter of national health security, that they have a wider role to play other than ensuring good biosafety and biosecurity practices in their own lab, but as part of the national laboratory network and infrastructure in handling and dealing with public health emergencies, ensuring that we have things in place. And so some of the key activities that we've been involved in over the years together has been a national laboratory facility mapping exercise that was conducted in 2017, and more than 500 facilities across sectors were identified. And we had the first region-wide survey on laboratory biosafety and biosecurity practices as well between 2017 and 2018 in 19 participating member states. And this has really guided, the results of those really guided what we focused on. The survey results at that time highlighted an absence of appropriate national policies, which I mentioned before, and this is in general for laboratory policies, and of course, none for biosafety and biosecurity. A continued lack of standard biosafety and biosecurity practices in more than 200 facilities, but only 26% of respondents performing annual maintenance and recertification of major pieces of biosafety equipment where those were available. So we've tried to target our activities in addressing those, of course, and in terms of our reach, what I wanted to say is that between 2013 and 2019, we reached just under 500 persons with at least one person trained in each member state. But since we've had to move to the virtual environment as a result of the COVID-19 restrictions, which has been challenging, we've been able to reach more than 1,000 professionals that have benefited from our virtual training sessions. Yes. And I'm very pleased. You'll note in the pictures there, Trinidad and Tobago in 2019, we held our first sub-regional workshop with 5 member states to discuss national frameworks for pathogen biosafety and biosecurity. And we hope that we'll be able to continue working with these 5 countries as a focus in the coming years to really move ahead with this. Of course, most of these countries already have national legislation governing the operations of labs in place, so it makes it a little bit easier. But also we hope to provide a roadmap on what can be successful in implementing such frameworks in our region, and for other countries to come on board with this. We always want to talk about impact, and sometimes that's difficult to measure while you're working in your program, in terms of stopping and taking stock, monitoring, evaluating just how are your participants from these different activities utilizing the information that they have. But I want to mention Belize, because in 2018 we trained 17 persons from Belize. And those 17 persons, the majority of them were able to go back to their own labs, not only begin utilizing the information from our course for themselves on the bench or in their execution of their own biosafety program management, but a total of 57 additional persons were trained across those different labs. So that makes me excited that the knowledge sharing continues, that our participants don't just keep it to themselves. And of course, that means that the culture of biosafety and biosecurity continues to grow. And so in terms of advocacy, it was mentioned that we have been part of a number of international networks, including the APP3 of the Global Health Security Agenda, but also we've done work with Biological Weapons Convention Implementation Support Unit. And I want to mention especially our regional coordinator for the UN Security Resolution 1540, Mr. O'Neill Hamilton, who has always worked closely with me on any opportunity for advocating with parliamentarians and national stakeholders to speak about matters of biosafety and biosecurity, not only from biological weapons threat reduction only, but in terms of public health. And we've been able to reach not only regional parliamentarians, but we've had targeted workshops in some countries. I think I saw one of our focal points, Mr. Hazron from St. Vincent. And so we've been working not only at the regional level, but in targeted countries as well, to promote the importance of having these national frameworks. And most recently, I had the opportunity to also share our work at the Biological Weapons Convention meeting of experts that was virtually held in August. So we've been doing quite a bit of work over the years in capacity building. And I think more recently, having developed or built a reputation among our peers, working with them to advocate for best practices. And so, Erin, if you can move to the next slide, please. I can't talk about biosafety and biosecurity without specifically mentioning COVID-19 response, because I believe that while in our region particularly, people on the bench understood the importance of it, it really came to the front with having to work in a pandemic. And it was interesting for me to see the way in which what we used to do in training sessions, the proper use of respirators, for instance, donning and doffing of personal protective equipment. These are things that were more or less in the lab, and now it's mainstream as part of COVID-19 response across different sectors as well. And so for us in our program, we've been able to assist in training persons in three countries prior to the implementation for COVID-19 alongside PAHO WHO and using a One Health approach, because in our region, we did see non-traditional laboratories stepping to the fore and providing that national assistance in terms of the COVID-19 response, and particularly the university laboratories as well. We reached more than 500 individuals, lab professionals across 17 member states. through several, through four sessions that we held during 2020. And it was very anecdotal, but encouraging that in one member state, they've actually been able to use the information that we've posted to our website. And I think on the previous slide, I did have the link to our training materials page where all the previous sessions, the slides are available. And this was a national accreditation officer that from a Bureau of Standards that reached out to me to let me know that they had actually used that information to make their own presentation and how useful their recipients had found it. So small steps, but the feedback is so important to know just how we're able to help to improve practices in other countries. And so I wanted to mention our work with our partners at IMPACTS. IMPACTS is the regional agency for crime and security. And together we were able to train more than 1,500 law enforcement officers from 17 member states in the proper use of personal protective equipment. As we know now, whenever we see a police officer, they're geared up due to COVID-19 measures. And so for me, this was really solidarity in action, health and security working together in a very tangible way. We continue to receive requests as well at CARFA, and the law enforcement professionals actually have the course available on their training site that's held by IMPACTS for regional use as well. And as I mentioned before, we really tried to focus on our network of national focal points and identified persons in their national networks, the safety officers in the national networks, to have dedicated sessions addressing biosafety and biosecurity specific issues over the year. And I think that our informal WhatsApp group has proven most useful in terms of sharing information, being able to ask questions in a very safe space, and just being there for each other. Next slide, please, Erin. And so, of course, during this time, we received a lot of requests for advice and support and risk assessment. So we're all moving towards a more risk-based approach to biosafety and biosecurity. The guidance that was coming out from WHO and PAHO, and of course now the new WHO's Laboratory Biosafety Manual 4th edition, which places a lot of emphasis on local risk assessment, help persons to really translate what we did in a number of trainings over the years for risk assessment to really apply it in their own labs and to show the value of it in terms of the measures that need to be taken, because not all labs necessarily have PCR or molecular tests. So making sure that measures in place are commensurate with the risk to staff and of course environment and the community. And next slide, please, Erin. And so as I mentioned before, I wanted to include a little bit on specimen transportation. One is very close to my heart. It's one of the first ways I got introduced to biosafety and biosecurity, being a trained shipper at CARFA with IATA, and being able to also expand the number of persons who were certified to handle and ship infectious substances between labs from our countries. CARFA maintains a database, and also the pool of persons trained IATA trainers as well, which we hope will become sustainable as we move forward to ensure that that need for that recertification every 2 years, it's not onerous in terms of the expense and cost for having to pay for those tests every 2 years through IATA. So we've been investing in our countries to have trained persons on the ground. And so what I want to mention here is that prior to the COVID-19 pandemic, member states, of course, we've had to rely on the availability of commercial couriers and regional airlines, such as FedEx, DHL, Caribbean Airlines for the transfer of clinical samples to our laboratory base in Port of Spain, Trinidad and Tobago. And at the time it was due to, and it is still true, due to the varying national capacities which exist for laboratory diagnosis, and something that will continue to remain for the confirmation of many infectious diseases. And the critical nature of the services that we provide was again highlighted by the CARICOM heads of government in 2014, when we were dealing with the threat of Ebola at that time. And in CARICOM's 10-point action plan to stop Ebola there and here, which then became the framework for the regional coordinating mechanism on health security, the importance of air connectivity is embedded in as part of that 10-point action plan. And so fast forward to 2020 and 2021, we have used, we at the regional level have used the feedback that we've gotten from regional tabletop exercises to enlist the assistance of military aircraft to transfer these biological materials between countries and to CARPHA. And that's an operation that's still in place to date. However, it's not a long-term solution. And so we are hoping that we will continue to do work on a paper that we presented to CARICOM's Council of Trade and Economic Development Transportation Group on being able to classifying these biological substances as regional public goods. So as we move back towards, swing back towards sort of normalcy in operations and laboratory operations referral systems, that countries would be better positioned with the couriers, the commercial couriers, to ensure the safe transport of these substances, because for many couriers in the region, it's not economically viable to maintain some of the certifications that are required to handle these substances. And so a lot of countries have to get creative in how they're able to refer their biological samples for testing. And so in this regard, work continues. And Erin, if you can advance to the next slide. As I wrap up, I wanted to speak a little bit about governance and leadership. And here I wanted to say that, CARPHA has been using its regional influence with other partners in the biosecurity sector. We're a member of the steering committee for the University of the West Indies Center for Biosecurity Studies. We have worked since 2018, 2019 with Parliamentarians for Global Action. And as I mentioned before, the United Nations Implementation Support Unit for BWC and United Nations Security Council Resolution 1540 to advocate with regional and national decision makers to adopt national policies which reflect the local context, risks, and emphasize multi-sectoral collaboration and sustainability. I mentioned before that advancing biosafety and biosecurity means advancing national laboratory systems first through policy and networks, and wearing my network manager's cap, which is also part of my role. We cannot speak about biosafety and biosecurity, again, without addressing issues of laboratory quality, preparedness for health emergencies, and the use of networks. And I think it's because of networks that we're able to leverage resources and have that resilience among countries operating in highly resource-constrained environments. And so at the 74th World Health Assembly session on laboratory biosafety held in May 2021, a real example of leadership was when we worked with the national authorities for a statement from Barbados, which was the first for our region in such a session to have one of our member states make a statement at the World Health Assembly on biosafety and biosecurity. And so, Aaron, if you move to the next slide, I wanted to say that none of this would be possible. None of the work that we've been doing over these years would be possible without multiple collaborations and the partnerships that we've fostered with a number of our collaborators, including the US CDC. And I want to make special mention of the Caribbean Regional Office through the PEPFAR program on our dear friend, Ms. Giselle Guevara, who has been a stalwart and working alongside CARPHA and many of the capacity building efforts. And of course, whenever the opportunity has presented itself, with advocating as well. And PAHO, WHO, the IDB more recently in terms of a targeted approach among 3 countries, not only looking at capacity building, but also looking at sustainable systems and national frameworks, the World Bank, the EU, and many others. And so in our role as chair, which has actually come to an end last month, we're now in a period of transition for the action package on biosafety and biosecurity. We have recognized that lots of resources exist and are available. And once you're part of the network, you're able to really leverage that. And all we need to do is to ask for assistance. But knowing who and where to ask for that assistance is important. And so what we've seen in our role as a member of that international network, we've been able to also help our own member states not only have more knowledge, but also to be able to try to do further matchmaking to help them improve their national capacities. And I want to mention some important collaborations that I think will be very important as we go forward in terms of South-to-South collaborations, the Africa CDC Signature Initiative, which is being spearheaded by the Global Partnership, and supporting the Biological Weapon Convention ISU's initiative on Youth for Biosecurity. Apologies for that. In terms of other collaborations that I look forward to, including with universities, I want to mention Dr. Ellie Graydon and her team from Georgetown University, currently working on the Biosecurity Library Project. That's something that, again, making resources available to everyone is going to be very important as we move along. And as an example of this type of collaboration and being part of international networks, if you move to the next slide, please. Thanks. I wanted to sort of end on an example of coming together and working together without money passing hands. And in the form of our CARPHA Biosafety and Biosecurity webinar series on implementation of WHO's new Laboratory Biosafety Manual 4th edition. This series was launched in June 2021. We've so far completed 4 out of the 5 sessions that were slated. So we had an overview session, and then we've delved into specific monologues that our countries, our CARPHA member states have said are important: risk assessment, waste management, and use of PPE. And the last one will focus on containment devices and biosafety equipment, such as biosafety cabinets. But since its launch, the series has reached 865 persons from 58 countries, right? Including the 20 CARPHA member states that we see there. And you can go to the next slide, please. Thanks. And as you can see, this would never have been possible without the valuable partnerships that have been created and strengthened over the years with PAHO, WHO headquarters, CDC, CRO office in the Caribbean. And I want to especially thank Dr. Chris Shield from the US CDC, who has worked with us in coordinating these very high level speakers for sessions. Many of them have been the authors of the monographs as well. And so we've really been able to have our members, our persons in the region have access to these experts directly to ask them questions, which I don't think would have been necessarily possible before being part of network. So again, the value of us working together and promoting, cross-regional approaches as well. So as I wrap up, Erin, you can just move to the next slide. And so I've told you a lot about the good things and things that we're proud of, but there are always things to be improved. And for us, for me in the program, the biosafety program at CARPHA, we have lots of data that we've collected, and we're about to embark again on another round of facility mapping followed by surveys in the member countries. So we also need to take a stock, and there's a need to evaluate the impact of our interventions. And of course, that's something where I think is a weak point, because there are a lot of competing interests, especially at this time, but it needs to be done. There is also need for us to have that balancing act between the technical experts, which I hope you can see that I really love. I love being part of the capacity building events with persons working on the ground, doing the practical aspects of it, but also being able to maintain the visibility among decision makers and ensure that these matters are taken seriously to be embedded in their legislative agenda as well. And as always with all programs, there is a need for additional dedicated human resources to execute the program of work. I've been fortunate over the past years to have interns or projects support short-term consultants, but it has been difficult, and of course we welcome any sort of support or further information requests on how you can be part of our team as well. So as we move to the last slide, really, I wanted to just end on what I think would be important for sustaining biosafety and biosecurity in the Caribbean and as part of our regional health security. And that would start with having policies in place. Again, there's a need to implement and maintain resilient, sustainable quality management systems that are rooted in the local context. In terms of improving the infrastructure, engineering at facility level, there is a perennial problem in our region, as exists in other regions with developing countries, an absence of certified personnel to calibrate or troubleshoot major pieces of equipment. And there is the cost of maintaining complex systems in an ever increasingly resource constrained environment. And we need to be able to keep up with technological advancements and what that means for biosafety and biosecurity as well. In terms of personnel development, we're always dealing with attrition of trained persons and the need for retraining. There is a need for integration into tertiary level curricula on biosafety and biosecurity to have more awareness of biosecurity practices, including the rationalization of biological inventories. Dual use is something that is probably not very well understood as yet. Bioethics and working with law enforcement as part of public health. But more than anything, we need leadership. We need to be able to remain a priority with the decision makers. And for me, I would say the time is now because of the pandemic and how all what we were doing in the background, labs in general, but definitely with biosafety and biosecurity has come to the fore. Not only to show gaps, but to show the importance and how quickly we've had to come up to speed in some instances to respond to these public health emergencies. And I want to end by giving you a part of the statement that was given by the Chief Medical Officer of Barbados at the 74th World Health Assembly, in which he ended by saying, and encouraging fellow Caribbean member states and small island development states to take accelerated actions to enhance national capabilities for laboratory biosafety and biosecurity, and to recognize them as foundational aspects of national health security systems that will serve to protect both resident and visitor populations and bolster the resilience that's required to face known and unknown biological threats well into the future. And so that's what we're aiming for. And so with that, on that last slide, I want to say thank you so much for your time and attention. And I hope that we can have a bit of discussion. Thanks so much, Erin.
Thank you, Sasha, for a fantastic talk. I applaud all of your efforts, the hard work of the entire team, and your leadership in advancing biosafety and biosecurity in CARPHA and globally. Really, the outreach that you've been able to do is quite impressive. So thank you so much. We have time for just a few questions, and I'm going to, if I may, ask the first. And I think it's quite interesting. We think about how much we've had to adapt to a virtual engagement in a remote environment during this pandemic. And there have been a number of challenges in terms of building networks with new partners and really missing that face-to-face interaction. But there have been a number of benefits in terms of being able to reach out to a number of people that we wouldn't normally have been able to, right? Particularly thinking about a lot of your training programs, really exponential increase in the number of individuals you've been able to reach out to. What do you think are some of the benefits of that virtual learning environment that you'll be able to continue to promote even post-pandemic?
Thanks very much, Erin. So I think one of the things has been being able to share freely afterwards. I think having the sessions posted online was never something that we would have considered before. And so ensuring the quality of what you're putting out online as well becomes important. So that's something that we're definitely going to be taking forward because we recognize it's not only our own countries that are using this information, but a lot of countries that, quite frankly, probably couldn't pronounce their names as well. So definitely in terms of that is something that we would want to see happening going forward. But it has been challenging. It hasn't been without its challenges. And for me, in terms of where the program that we have at CARPHA has come, it's really a practical sort of course. So in one sense, I've been able to run what I would call a blended approach program for one country, Trinidad, because we're based right here. And so the feedback was that everything was great, but they really enjoyed the one day where we had the practical in-person sessions. So as much as we can try, and we will continue to utilize a virtual environment, I think the work that we're doing in biosafety and biosecurity requires that sort of face-to-face interaction. I can't really tell if when we're looking at how someone uses the biosafety cabinet, using a camera in terms of, okay, stop right there, pause. But if you're right there and in that training lab environment, you're able to work through other aspects a lot easier. But the value of developing these videos and being creative as well, I think is something that we're going to take going forward. So thanks for that.
Wonderful. Thank you so much, Sasha, and great points to consider. Well, we are out of time for today, and we had a number of questions that I'd be happy to share with you offline, and maybe we can address and post on our event page. But I want to thank you for your time, for your fantastic input. Thank Dr. Indar for her opening remarks. It's just been an absolute pleasure to have you here with us today in honor of Biosafety and Biosecurity Month. And on behalf of the Griffin Program, the Center for Global Health Science and Security, and the Global Health Initiative at Georgetown, we thank you so much for your participation.
Thank you so much. Thank you very much, Erin. And I do hope that we stay in touch. And I look forward to the questions that we can probably post afterwards as well.
Wonderful. Thank you so
Thanks
much.
to everyone as well for joining.
Yes, thank you all for attending.